Hello, my name is Nathan. I'll be presenting how to properly image the sacrum with the AP Axial Projection. First of all, the clinical indications for doing so would be pathologies of the sacrum and fractures. The technical factors for the AP sacrum are a SID of 40 inches with a field size of 10 inches by 12 inches. The IR will be portrait in the bucky. A grid must be used and KV set within 75 to 90 depending on patient size. It would be most desirable if the patient's bladder and colon were emptied and free of continence prior to procedure for image clarity. Before we get into positioning, let's talk about the basic anatomy of the sacrum. The sacrum has a shovel shape, which is concave when looking at it in an AP view. From top to bottom, we start with the body of the fifth lumbar moving inferior to the L5-S1 joint space. This then continues to the promontory of the sacrum. On both sides of the lateral superior portion of the sacrum are the ala. Lateral to the ala is the sacroiliac joint. The body segments are located between the pelvic sacral foramina, and at the bottom of the sacrum is the apex. Next, let's talk about important landmarks for positioning. The central ray for the AP axial sacrum is aligned mid-sagittal and 2 inches superior to the symphysis pubis. The symphysis pubis is never to be palpated, so an alternative landmark can be palpated that is in similar location as the greater trochanter. The ASIS is also another landmark that can be palpated. The central ray should be positioned about 2 inches inferior to the ASIS. Also, make sure the light field is at the level of the iliac crest so the L5 is not cut off in the image. Place the patient in a supine position with the arms at their side. Put a pillow under the head for comfort and extend the legs. Place a support under the knees if comfort is desired. Angle the central ray 15 degrees cephalad as shown. Use popper collimation and place your right marker in the upper right of the light field as displayed. We will start by getting the central ray 15 degrees cephalad. Then feel for ASIS. Move the central ray 2 inches inferior to the ASIS. Make sure the CR is mid-sagittal on the patient. Place the right marker in the upper right corner of the light field and have the patient suspend respirations and take the image. The image should be free of any obstructions in the lower bowels. The image should demonstrate the entire sacrum, SI joints, and L5-S1 intervertebral joint space. There should be no rotation on the sacrum, demonstrating the sacrum free of foreshortening. Correct angle and alignment of the CR will show the pubis and sacral foramina are not superimposed. POW.